We recommend that every patient with CF be followed in a CF care center that's accredited by the Cystic Fibrosis Foundation. I think that's very important to ensure that care is being done according to the absolute best evidence-based guidelines and all the resources that are available at a care center. And so that means it's very important for them to come to a CF care center. But it's also very important for them to have a pediatrician, because a pediatrician does a whole host of other things that have to do with healthcare maintenance and immunizations and anticipatory guidance and injury avoidance and other things that they are really the experts in. And so they're an important part of the care team for a child with cystic fibrosis.
Calling the CF Center can sometimes be really confusing, especially for families with infants, so we encourage families who have infants to call us anytime and we'll help them determine. But a good rule of thumb is if there's a problem with the sinuses, the lungs, or the stomach and GI tract, you call your CF Center. If it's a rash or a fever, you call your pediatrician.
Part of the CF team is first and foremost the patient, their family, and the healthcare team. And that healthcare team consists of many, many different components.
The CF care team is a group of professionals with different specialties that all of them are important. The doctor is not the most important. Every member of the team is as important as the other one. In general terms, the team is composed by a physician, coordinator that might be a nurse or some other professional. Then you have nurses, dietitians, social worker, respiratory therapists, pharmacists, psychologists. A CF doctor is usually a pulmonologist. He will care for the acute issues and also plan along with the team for the issues that will happen 5, 10, 15 years from then.
A coordinator has many hats. At some centers, the coordinator just manages patient care. And other centers, the coordinator manages the team, which means she may have a role as a research coordinator, as part of the care team. She manages quality improvement. So she or he can do many, many things.
The CF nurse has many different roles. They can act as a triage point of person, so answering many different phone calls, whether the child is sick or you have questions about medications, need medication refills, questions about infection prevention, or even just questions about your durable medical equipment. They also can help in the outpatient setting, seeing the patient and helping with clinic flow, and then there's the nurses that help inpatient as well.
The dietitian in CF Clinic helps people apply the science of nutrition to everyday life, working with children to feed and nourish them so that they grow and develop normally.
The social worker focuses on the psychosocial aspects of cystic fibrosis, so including adjustment to illness issues, issues related to finance and insurance concerns, different transitions across the lifespan, so like when a patient starts school and when a patient makes that transition to the adult CF center, and also can help families with any mental health issues such as depression and anxiety.
So as a CF respiratory therapist, it's my job to meet with patients and collaborate on methods of airway clearance and medications that help with their lung health. So we discuss different types of therapies, new therapies on the market, and together we collaborate and figure out which of these therapies work for them.
A CF physical therapist helps people with CF in aerobic, strength, flexibility, and breathing exercises. We also do a lot of manual therapy for the spine, shoulder, rib cage to help prevent musculoskeletal problems.
An RC or a research coordinator is responsible for the day-to-day activities of a clinical trial, and that may include recruiting patients, obtaining informed consent, collecting data, and performing study visits. The coordinator is also responsible when conducting the study visits to ensure that the visits are conducted per the protocol.
A cystic fibrosis pharmacist does lots of things. They're there for you to answer questions that you may have regarding any and all of your medications that you have, whether that they be prescribed medications from your cystic fibrosis doctor, or over-the-counter medications that you may purchase at the store that you may have not told the cystic fibrosis team about, and the cystic fibrosis pharmacist can help you in taking those medications the proper way. Each of the medications you're getting is the correct dose, the correct timing, and also is it interacting with other drugs and making sure that it's not doing that and that it's safe.
It's very important for a patient with cystic fibrosis to be followed regularly. And the current CF Foundation guidelines are that every patient with cystic fibrosis should be seen at least every 3 months in a CF care center. Now, they may need to be seen more than every 3 months under certain conditions. They're very young while they're trying to establish weight gain. And people whose clinical condition is changing significantly may need to be seen more frequently.
The second visit we had to learn about CPTs and be able to do some nebulizers. So we came in pretty often just to be able to support him and go through it. But average or regular is about every 3 months.
A CF clinic visit can be very busy. It typically starts with registration, where we get information to help us see you during the visit. Then measurements are done, and those include height and weight. They also include pulmonary function testing for children who are old enough.
My clinic visits, I meet with my doctor. I meet with my pulmonary therapist, and my pulmonary therapist takes me in to do my PFTs to check my lungs and make sure everything's working good. And then we come back to the room and we meet with a dietitian who goes over my growth in my height and my weight, and they go over my vitamins. And then later on, a social worker will come in and make sure everything's going good and just check up on us. And then once a year, we have a pharmacist who comes in and checks on my medication and my vitamins and make sure it's all good. And also on that once a year visit, we do an x-ray of my lungs and draw blood, and then we bring my best up for a checkup to make sure it's all functioning good and everything is just good with it.
The beauty of having the care team working in collaboration and coordination is that we all talk together, and then collectively we take all of our individual expertise and we put that all together to make your care the highest level that it can be.
Clinic visits are an important part of your CF care, and the reason for that is we want to stabilize your lung function. We want to keep you healthy. Utilizing the clinic time to ask questions, find out more about your CF disease and what's unique to you, and partner with your care team members. Be involved in making decisions about what you want to do in relation to your day-to-day CF routine. And let us know what you're able to do and what you're not able to do, so that we can help you live a fulfilling life and be able to do all the things you enjoy every day.